Hi everybody, my name is Lulu Achua. I am going to be performing vital signs with my patient Miss Amel today. Before I start, I get into my patient's room. Check Before I go to my patient's room, I check the doctor's order, and then while in the room I perform hand hygiene. I introduce myself to the patient. I wash my hands, I gather my supplies, and I provide privacy to my patient. And also I make sure I identify the patient with the two form of identification, which is by asking her to tell me her first last name, and I check with the armband and with her date of birth as well. So here I'm going to start with the blood pressure. I have my stethoscope here and my blood pressure cuff, which is the right size for my patient. Hello, Miss Amel. My name is Lulu. I am going to be your nurse for today. And today we're going to be, I'm going to be checking your vital signs, okay?
Okay.
So we're going to start with the blood pressure. Do you have any issues with your blood pressure?
No.
So normally what is your blood pressure like?
120 over 70.
Okay, that's good. Do you take any medications for that? Since you don't have it, no?
No.
Okay. So I am going to be checking your brachial. Can you please, do you have any hand that you prefer?
No.
Okay.
Yeah.
So I have washed my hands. I provide privacy to my patient. I'm gonna check your name. Please, can you tell me your first and last name?
First name is Amel, last name Kua.
Okay, and I'm gonna check with the armband to verify so I'm dealing with the right patient. I have cross-checked the doctor's orders, and I am on the right track. And again, before I start, I gotta make sure my patient is not on any IV line, and which, yes, you can see she's not on any IV line, and she doesn't have a preferred arm, so I'm gonna be using the right arm. Let's do this. So I'm going to apply the curve 2 to 3 centimeters above the brachial artery. And at heart length. Please make sure you sit with your foot flat on the ground. Thank you. Now I'll start pumping, okay?
Okay.
So at the point where I get her first beep, I will pump 30 mm a little bit above. Your blood pressure is a little high. It's 160 over 80.
Is it model?
Now I'm gonna be checking the heart rate, and I'm gonna do the heart rate and the respiration together, but my patient is not gonna know when I'm doing the respirations. So this is my watch that I'm gonna be counting it with. So I have to check the radial artery. Okay, so I'm gonna check it for 30 seconds, then I multiply it by 2. The heart rate, I had to go for a full minute because she was a little bit dozing off, so I got a little bit mixed up, so I had to go for a whole full 1 minute, 60 seconds. The heart rate is 75 beats per minute. And while I was doing the heart rate, after the heart rate, I had to measure her respiratory rate without letting her know. I watched the fall and rise of her chest. That is 22 beats per minute. I'm going to be checking her temperature right now, but I do not have the thermometer for oral temperature, so I'm going to be using my gun for the as I call it, gun. I'm going to be using this to check her temperature with. And on the norms, if I was using the oral thermometer to check the temperature, I will ask her if she has had anything to eat or drink or even smoke within the last 15 minutes. If she had, then I'm going to wait for 25 to 30 minutes before I check her temperature. But since I'm going to use this one, that is okay. I'm going to do it right now. Miss Anel, I'm going to check your temperature, okay?
Yes.
It's a contactless thermometer. And her temperature is 97.7, which is okay. Now I'm going to be assessing my patient's pain scale. Miss Amel, do you have any pain at the moment?
Yes, on my knees.
Oh, sorry to hear that. What happened to your knee?
Yeah, I was trying to clean my garden and then I made a mistake. Yeah.
I'm so sorry.
Yeah.
So, do you take anything for the pain?
Yes, ibuprofen, 200 milligram.
Okay.
Yeah.
So, I'm going to be assessing my patient using the method of OPQRST. So, the chief complaint is that she's having a pain located on her knee, caused by injury when she was working in her garden. The onset, when did the pain begin?
It happened yesterday.
Yesterday morning. Okay. Yeah. What makes the pain worse?
When I was trying to bend.
So when you try to bend, it makes it worse.
Yeah.
Okay, I'm so sorry. So describe your pain level. Describe how the pain feel.
Between 0 to 10, I could say is 8.
That's the severity of the pain. So your pain scale is 8.
Yeah.
Oh, that's so severe. Then you need something stronger than the ibuprofen.
Yeah.
So when was the last time you took your ibuprofen?
It's 2 hours ago.
Okay, all right. So let's give it a little time to kick off, and then if it doesn't get better, you take something different, okay?
Okay.
Or something stronger. And does the pain spread elsewhere, like in other parts of your body, or just on your knee?
Just on
the knee.
Yeah.
Okay, that's better. How long does the pain last? Well, when you have this pain, like when you start feeling the pain, how long does it last? Like 30 minutes or 1 hour or 10 minutes, 20 minutes?
Oh, let's say 1 hour.
Okay. So after the ibuprofen, it goes down a little bit. All right, that sounds good. And you say it doesn't move to any other parts of the body. How do you describe it? Is it like achy pain, or it just hurts, or it's achy?
Achy.
Okay.
Yeah.
All right.
Pain.
Okay. All right. That's good to hear. I'm so sorry. And I have documented the pain level and everything that the patient complained about. And after all the vital signs assessment, I have to make sure I document my findings from the blood pressure, the pulse, the temperature, and the pain scale. Thank you for listening. Thank you, Miss Ame.
Thank you.
Now I wash my hand and I leave my patient's room.